The intersection of endurance sport, health, fitness, and life. Challenging conventional ideas and empowering people with the science of self-propelled motion. This is the Endurance Experience Podcast, hosted by Tony Rich.
We've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic. Let's look at Ebola. I'm sure all of you read about it in the newspaper. Lots of tough challenges. I followed it carefully through the case analysis tools we use to track polio eradication. And as you look at what went on, the problem wasn't that there was a system that didn't work well enough. The problem was that we didn't have a system at all. In fact, there are some pretty obvious key missing pieces. We didn't have a group of epidemiologists ready to go who would have gone, seen what the disease was, see how far it had spread. The case reports came in on paper. It was very delayed before they were put online, and they were extremely inaccurate. We didn't have a medical team ready to go. We didn't have a way of preparing people. Now, Médecins Sans Frontières did a great job orchestrating volunteers, but even so, we were far slower than we should have been getting the thousands of workers into these countries. And a large epidemic would require us to have hundreds of thousands of workers. There was no one there to look at treatment approaches, no one to look at the diagnostics, no one to figure out what tools should be used. As an example, we could have taken the blood of survivors, processed it, and put that plasma back in people to protect them. But that was never tried. So there was a lot that was missing, and these things are really a global failure. The WHO is funded to monitor epidemics, but not to do these things I talked about. You can have a virus where people feel well enough while they're infectious that they get on a plane or they go to a market. The source of the virus could be a natural epidemic like Ebola, or it could be bioterrorism. And so there are things that would literally make things 1,000 times worse. So this is a serious problem. We should be concerned. But in fact, we can build a really good response system. We have the benefits of all the science and technology that we talk about here. We've got cell phones to get information from the public and get information out to them. We have satellite maps where we can see where people are and where they're moving. We have advances in biology that should dramatically change the turnaround time to look at a pathogen and be able to make drugs and vaccines that fit for that pathogen. So we can have tools, but those tools need to be put into an overall global health system, and we need preparedness. What are the key pieces? First is we need strong health systems in poor countries. That's where mothers can give birth safely, kids can get all their vaccines, but also where we'll see the outbreak very early on. We need a medical reserve corps, lots of people who've got the training and background who are ready to go with the expertise. And then we need to pair those medical people with the military, taking advantage of the military's ability to move fast, do logistics, and secure areas. We need to do simulations, germ games, not war games, so that we see where the holes are. The last time a germ game was done in the United States was back in 2001, and it didn't go so well. So far, the score is germs 1, people 0. Finally, we need lots of advanced R&D in areas of vaccines and diagnostics. There are some big breakthroughs, like adeno-associated virus, that could work very, very quickly. Now, I don't have an exact budget for what this would cost, but I'm quite sure it's very modest compared to the potential harm. The World Bank estimates that if we have a worldwide flu epidemic, global wealth will go down by over $3 trillion, and we'd have millions and millions of deaths. These investments offer significant benefits beyond just being ready for the epidemic. The primary health care, the R&D, those things would reduce global health equity and make the world more just as well as more safe. So I think this should absolutely be a priority. There's no need to panic. We don't have to hoard cans of spaghetti or go down into the basement. But we need to get going because time is not on our side. In fact, if there's one positive thing that can come out of the Ebola epidemic, it's that it can serve as an early warning, a wake-up call to get ready. If we start now, we can be ready for the next epidemic.
That was a clip from a TED Talk Bill Gates gave 5 years ago. So that was in 2015. Fast forward to today, here we are in the teeth of a global pandemic from the coronavirus. My guest on the podcast to discuss the latest information and relevant questions in regards to the coronavirus is Dr. Nadia Abuelezam. She is an assistant professor at Boston College and an epidemiologist. She trained in infectious disease epidemiology at the Harvard T.H. Chan School of Public Health. She has expertise in mathematical modeling, data analytic approaches in public health, and mitigating health inequities for vulnerable populations. Her current research focuses on understanding health risks in hard-to-reach populations, including immigrants. The goals of her program of research are to use quantitative methods and novel data streams to better understand inequities in health outcomes and healthcare access in resource-poor settings and vulnerable populations. So on the podcast, we talk about some of the fluent and relevant guidance in regard to the coronavirus and best practices to avoid infection. We get into some of the details of the do-it-yourself masks and physical distancing and hygiene and such. And then we go into the general risk profile and whether or not there's any new and fluid details in regards to the risks of populations. We talk about the immune system and whether or not there's any credibility to the idea of boosting one's immune system. And given that Dr. Abuelezam's expertise is in the disproportionate effects of vulnerable populations, we talk about the disproportionate effect to the Black community, my community. So I'm very interested in that topic, and we have a good conversation about that. And then we talk about what the off-ramp is going to look like in order to get back to some level of normalcy. So we have a great conversation, and Dr. Abuelezam is a very interesting person. She's also an endurance enthusiast. She's completed multiple marathons, multiple half marathons, and is also a CrossFitter. So she's a part of our endurance enthusiast community. So, without further delay, I give you Dr. Nadia Abuelezam.
Great.
Dr. Abuelezam, thanks for coming on to the podcast.
Thanks for having me.
Okay. Well, I think these are unprecedented times, and I just want to thank you up front. And I know you must be very busy right now, so I want to be sensitive to your time and get into the questions that I have for you. But first, perhaps you can talk a little bit about epidemiology. Some of our listeners may not know about the term. So if you can, just describe it and give a little color about why you decided to get into it and maybe even some of the concentrations that are a part of your research agenda.
Absolutely. So epidemiology is a field within the discipline of public health. So it is one of the main, I would say, sciences in public health. And epidemiologists really are interested in understanding health and disease at the population level. So while the medical field or clinicians are really interested in understanding the health of individual people and helping to treat and prevent disease at the individual level, epidemiologists are really interested in understanding health and disease at the population level. And then further, we're really interested and tasked with trying to prevent illness at the population level. I got into this field in sort of a weird way, in the sense that I was a math major in college, always had been really attracted to quantitative fields and also scientific fields. And while I enjoyed math, I didn't really see the point of doing math for the sake of doing math. I didn't understand why I had to do proofs or anything like that. And so I was looking for a way to use my quantitative skills to help people. And ever since I was a child, I thought I'd want to be a medical doctor, but realized I probably didn't have the bedside manner, and I'm not sure that I wanted to work at the individual level. And so I haphazardly found public health and epidemiology, and I think it's a really neat way in which I can use my quantitative skills to help people and to also improve health at the population level. And there are many different types of epidemiology. I was trained in infectious disease epidemiology, so I mostly think about diseases that can be spread from person to person. But there are other types of epidemiology, people who study nutrition, people who study chronic diseases like diabetes or chronic coronary heart disease. And there are even people who study environmental health hazards like pollution or climate change and their impact on our health. So there's a wide range of epidemiologists who have interests in all sorts of disciplines. And I think I will say that epidemiology is complementary to medicine. What we do helps doctors. While most of us are not medically trained, the work and the evidence that we provide with our studies and with our analyses certainly should help doctors in understanding how better to practice medicine, the types of treatments that should be available, and how we can prevent disease in populations. Got it.
All right. And also, you're currently a professor at my alma mater, Boston College.
I am. I'm an assistant professor. I'm in the School of Nursing, which is a different fit for me. I'm not a nurse, but I was the first epidemiologist hired at the School of Nursing. And the reason for that is Boston College, like many other schools now, are starting public health programs. So a lot of students are really interested in understanding what public health is and how they can make a career out of it. And so we have a burgeoning public health program now for undergraduates at Boston College.
Great. Okay. That's good to know. I thank you for that. Now, let's dive into where we are. So we're having this podcast on April 9th. I feel like just a month ago on March 9th, it was a different world. So, so perhaps you could catch us up about, where we are with the latest understanding of the coronavirus and the COVID-19 disease. Where are we generally? And I feel like some of the positions and beliefs about its comparison to the flu are falling in within a broad range. So if you can catch us up on the mechanism of transmission and some of the best practices to avoid infection in these times.
Absolutely. And these are really important questions, and they're questions that I've been thinking about quite a bit. So, in the last month, we've seen an explosion in the number of cases of coronavirus. We now, as of today, have over 1.5 million cases of the coronavirus worldwide. And in the United States, that number is close to 450,000 confirmed cases. And that was probably unimaginable about a month ago, as you said. And so to think about all of the knowledge we've gained in the past month and all of the knowledge we've yet to gain can be really informational for people, but can also help equip them to make better health decisions. So currently, what we know about the coronavirus is that it is transmitted through droplet transmission, which essentially means that if I'm speaking to you and a little bit of my spit happens to fly out of my mouth, and that spit manages to make it into your mouth or your nose or your eyes, there's the potential that if that drop of my spit had some virus in it, it could infect you. And that is one of the main ways we believe that this is transmitted. Now, the virus from my body could also make its way to my hands, and from my hands, it could make its way onto surfaces. And so if you happen to come by a few minutes after I've touched a doorknob, you could also perhaps contract the virus from the doorknob by touching it and then touching your face, your nose, your mouth, your eyes. So really, you may or may not know, but a virus is not a living particle. It doesn't live on its own. It actually requires the human body to replicate. And so the virus's sole goal is to make it into the human body in order to be able to replicate. And the two primary ways that it can do that is, again, through droplet transmission or through surface, or what we call fomite transmission. There has been some research, and I will say, this is research that was done in a laboratory. So, these are conditions that are very specific with regard to humidity and temperature. But in the lab, there was evidence that the virus could be aerosolized or suspended in the air for a number of hours as well. We don't know if that's true in sort of real life circumstances, but that is sort of one of the motivations for now. As many people are probably aware, a lot of cities are asking people to wear masks out in public. And the idea of wearing a mask is really that it ultimately reduces the number of surfaces that a virus can infect. And it also allows for reduction of transmission from someone who may have the virus to someone who does not. The other things that people can think about in terms of reducing their potential risk, we've said this before, we'll keep saying it, washing your hands. Wash your hands with soap and warm water for 20 seconds. The other thing is to try to avoid touching your face, your nose, your eyes, your ears, your mouth. Those are places where the virus can infect. So it's really difficult. I have a really hard time doing that, but I think we have to train ourselves not to touch those surfaces. And then, thinking about things like social distancing, which most of the country is now participating in, trying to reduce the number of people that you come into contact with on a daily basis, minimizing your interactions with people outside of your household, and really reducing the number of potential transmissions that are occurring in a particular community. So as I've said, I believe most of the country is now participating in social distancing. And, even if your particular state or city is not requiring it, it's definitely a way that you can protect yourself and your family as well.
Yeah, thank you for that. And just some points of clarification for our listeners. The coronavirus, this particular, is a strain of various types of viruses, and COVID-19 is the disease that results from the virus. Is that correct, or am I saying that correctly?
Yes, so the actual virus that we're talking about is termed SARS-CoV-2. So that is the name of the actual virus, and it is a type of coronavirus, and we've seen many other types of coronaviruses in the past, things like SARS or Ebola or MERS, which is the Middle Eastern Respiratory Syndrome. They're all coronaviruses. So this is a new type of coronavirus that we're seeing now, and what we're calling the disease, the physical manifestation of the virus once you're infected with it, is COVID or COVID-19, and the 19 represents the year in which the disease began in China at the end of the year 2019.
Got it. Okay, yes, there's a lot of confusion, I think, about that. And the do-it-yourself masks, state and local governments are now recommending that you go out with masks. And there's been some confusion about the efficacy of those masks. So is the view now that those do have some efficacy in stopping transmission?
And I think this is a really important question. And if I'm going to be honest with you, I think that there has been quite a bit of confusion in the messaging coming from public health people, but also coming from officials as well. Because if you remember, a month ago, the messaging was, don't wear masks out in public unless you have a cough. And a lot of that messaging, I think, originated in the fact that we just didn't have enough masks at the time to go around. And we still don't have enough masks right now to go around. So the idea now is that there is sufficient community transmission, meaning we do believe that people are out and about with the virus and able to transmit the virus. And because that's happening at sort of regularly, at a rate we don't actually know, but we believe to be regular, one way that people can potentially protect themselves is to cover their mouths and their noses with a mask. Now, as you've mentioned, there aren't enough medical grade masks to go around, and we're not actually recommending that people wear medical grade masks on a daily basis. What we are recommending is that they find a way, whether that's with a scarf or a homemade mask, to cover their nose and their mouth. And I just want to say a few things about that. One is the reason you're wearing the mask or the covering is because you want to avoid the viral particle coming into contact with your nose or your mouth. So you have to act at all times like there is viral particle on that mask. So that means that you shouldn't touch the area near your nose or your mouth when you're wearing the mask, because that if there was virus there, you could be transferring that virus to your hand. So really, only apply and put the mask on from the handles, the ear handles, and only remove the mask from the ear handles. There should be no touching of the actual surface of the mask. And if you are using a cotton or cloth mask, it is really important that it's washed after every use, because there could be virus on there. And the other thing that could happen is you sort of also could be harboring bacteria because it's moist from your breathing. So it's really important to remember that we're wearing them in order to protect ourselves from the virus, but that also means that we have to act like the virus is there. So protecting ourselves and making sure that we're using appropriate mask safety is really important.
Got it. Okay. That's really hard too. And, trying not to touch your face, trying not to touch clothing that you have, it's really hard to do. And that I've realized this, and people are seeing that this is really part of the challenge. Okay, final follow-up on that. Surfaces, to your knowledge, do viruses survive better on other surfaces than say copper, metal, wood, so on?
Yeah, so the evidence, again, from that same study that I cited earlier, from what was done in a laboratory, suggested that the virus can last the longest on plastic. And they actually found that it could last for more than a day on plastic, which is really worrisome. And then things like cardboard or paper, it could actually last for 12 hours. Things like copper, more like 4 hours. So it really ranges depending on the type of material that you're thinking about. But generally, what I would recommend is a frequent disinfection of surfaces in your household, especially those that people come into contact with often. The first thing I recommend is doorknobs. The second thing I recommend is light switches, and then any surfaces in the kitchen or anywhere else that get sort of frequent traffic. And I just want to say that the way that these disinfectants work is they actually need to dry fully to sort of get rid of the bacteria and the viruses. So when you do wipe something down with a disinfectant, whether that's Lysol or Clorox or whatever it happens to be, make sure that you let that dry on its own, because that's really where the efficacy comes in.
Yeah, I hear you. Keyboards, mouse pads,
yes.
mice. Yes. There are so many things that you just touch frequently, I realized.
Cell phones.
Cell phones
are big ones, yeah.
Right, yeah. All right, let's move on to the risk profile, and this is an important one, and it seems like there has been some confusion about this as well. So, are there any fluent details about the general risk profile? And there are a lot of listeners of this podcast that are what we call endurance enthusiasts, marathoners, Ironman triathletes, and ultra marathoners and such. And so I'm thinking about whether or not the risk profile is different for, say, male, female, young, old, healthier versus not as healthy, and then certainly super fit athletic types. What's your thoughts there?
Yeah, so I mean, I think people have probably heard that those who are older, and I'm not going to say old because older is what we're considering right. 60 and older, do have a higher risk of complications associated with this virus. So what we're finding is that those who are 60 or older tend to have or are more at risk for having complications. The other thing that puts people at risk also is having underlying health conditions. So those can be health conditions related to the respiratory system, so things like asthma, but they can also be chronic diseases like hypertension or diabetes. Obesity is also another one that we're observing right now as chronic health conditions that put people at risk for having complications associated with the coronavirus. We don't have generally population level data yet on overall risk factors, but some evidence out of China suggests that men are more at risk than women. And there is some evidence that children have less severe disease than adults. I have not seen any data with regard to fitness. I have heard many sort of anecdotal stories, which take them for their face value, that sort of no one can really be spared from the potential effects of this virus. There doesn't seem to be a rhyme or reason to some people developing severe illness. I've heard of cases of athletes who are relatively fit who've had to be intubated and are dealing with severe consequences. But then I also know people who have managed to stay healthy despite having known contacts with people who are positive for the virus. So I think right now we just simply don't know enough to say whether or not there are patterns. But I would say that generally from the data that we do have, no one is not at risk. Right. And I just want to emphasize that everyone should really take precautions regardless of how healthy you feel, regardless of how fit you feel. I think it's really important to make sure that you're taking the proper precautions, because it's not only about protecting yourself and making sure that you're able not to be infected, but the reality is your health is connected to your family's health, to your friends' health, and so by protecting yourself, you're actually protecting those around you as well.
Right. Yeah, that makes sense. And I think with the endurance enthusiasts, was the environments in which they train or race. Many of the races have been canceled, and I think those were the right decisions, or probably the only decisions that they could have made, canceling the big events like the Boston Marathon and some other races like that. I mean, you're running, your nose is running, you're putting food in your mouth, and then people are slapping high fives with everyone throughout the entire event. Yeah. So that undoubtedly was the right decision. I've gotten questions from the athletes about, hey, coach, can I go swim? And then I was like, yeah, that's a good question. I think United States Masters Swimming released something saying that they're not aware that viruses can be transmitted in chlorinated water. I don't know if you have any perspective about that, but stuff like that. People are asking about running, and there was a recent study from the Netherlands. I don't know if it's high quality or not, looking at droplets that are spread in running and in cycling. And so I think these are some of the things, like you're saying, that there probably isn't a whole lot of data out there on it, but it's something that we really need to take a look at more closely.
Yeah, and I will say that, as I've said to you before, I am a runner myself. I was supposed to run the Ragnar Cape Cod Relay later in May.
Really?
And yeah, and I had been training for that. And I will say, take this for face value in terms of my own behavior, but I am going out for runs. I am trying to avoid interacting with people on those runs. If I do see another runner out, I will try to go to the other side of the street if possible. I'll try to keep some distance. And so I think, being outside is generally healthy. There is some evidence, although I will say that I wouldn't sort of advocate for this, but sort of the UV rays of the sun can have some protective benefits as well. So thinking about getting outside and running may not be a bad idea. I don't know enough about swimming to say anything concretely about that. But that's sort of what I'm doing right now myself.
Yeah. And also a 2-time marathon finisher, 2-time New York City marathon finisher. That's very impressive. So you're one of us for sure.
Definitely.
Yeah, I've been out and running too. I've been recommending people go out and running, staying away from crowds and such. And the thing is about with endurance enthusiasts, we know how to train in isolation. We know how to train indoors, so it works. Okay, let's talk about the immune system. And I've seen many articles, I'm not sure if they're high quality or not, about immune system, mainly from the fitness enthusiasts. People talking about, in these times, here's how you quote unquote boost your immune system to make it sort of virus proof. I just want to hear this from the position of epidemiologist. Is there any way that, to your knowledge, anyone can boost your immune system either with, activity or nutrition or anything like that? What are your thoughts on that?
Yeah, and I think that this is a bit of a controversial issue in our field right now, because I think, again, the messaging on this has changed as well. Originally, and I was one of those people who said, do everything you can to make sure your immune system is functioning well. So things like getting enough sleep, things like taking your vitamins and minerals, things like making sure you're eating a varied, healthy diet, getting out and doing some physical activity. Those are all ways that you can make sure that your immune system is healthy and able to fight sort of viruses and other types of infections. And I do think that there's some value to that, right? If we can make sure that our bodies are prepared in case they are infected with the virus, I think that goes a long way to maybe allowing us to fight the virus off, or to reduce the number of symptoms we have, or maybe even to reduce the number of complications. I think what makes me hesitate to sort of say that frequently now is that the patterns we're seeing are sort of a little bit unexplainable in the sense that there are people with very healthy immune systems, no prior issues, no prior complications, that are, developing very severe disease. So it will not be a guaranteed way to prevent your acquisition. It will not be a guaranteed way to prevent severe complications, but it certainly wouldn't hurt. And I think that that's something I've kept in mind personally as we've been going through this. And I think, as I've said, making sure you're getting enough sleep, varied, healthy diet, vitamins and minerals, physical activity where possible. Those, to me, are all things that people can do to try to help protect themselves and keep their bodies healthy.
Yeah, and this is the one that I'm going to watch more closely and see if there is any high-quality study coming out. Because me personally, I in my years of being an athlete, I've not gotten sick ever. I was talking to my primary care doctor about it. I would say probably over 20 years, not gotten sick. I mean, I get the flu shot when I can remember to get it, but I've not gotten sick. So something that I'm watching, if there is any high quality studies that come out in the future about athletes, people who exercise and train regularly, whether or not that if there's any statistically significant research coming out in that field. But I just wanted to ask and get that get your perspective, because there's almost every day I see some article about quote unquote boosting immunity, and usually it's tied to the selling of some sort of supplement or something like that. So, but we'll take a look at it more closely, and hopefully there'll be some more research coming out. Okay. So this next question is right up your research agenda. There's been some information recently about the African American community and the exposure to the higher exposure to coronavirus. And so your research focuses on the health risks of vulnerable populations. And so what can you tell us about the disproportionate effects of the coronavirus on vulnerable populations?
Yeah, and I think this is such an important question. As you said, we're speaking right now at a time when a lot of this research is now coming out about how there are a lot of health inequities with regard to coronavirus. As you said, it seems like Black and Latino Americans are more at risk for acquiring the virus. It also seems like Black and Latino Americans are more at risk of not being tested for the virus. And then we're also seeing that Black and Latino Americans are more at risk of experiencing severe manifestations of the disease and also of dying from the disease. So those are some really worrying results that we're seeing, data that we're seeing out of many cities across the country. New York City, Chicago, Philadelphia, these seem to be patterns that are occurring across the country. And, I have to say that I've been a bit disappointed with the messaging that's been coming from our health officials about why this is happening. And if you've been following, you may have heard that, people are saying, well, these populations, Black and Latino Americans, tend to have more coexisting conditions. So, tend to be more obese, tend to have hypertension, tend to have diabetes. And because of that, this is the reasoning that's being given, we're seeing more severe disease in these folks. Well, that may be true. We may be seeing more comorbidities in these populations. But the real question should be, why are we seeing more comorbidities in these populations? What is the reason behind the increased risk for diabetes and obesity and hypertension in these populations? And ultimately, we have research on that. We actually understand quite well that there is something inherent about living in the United States of America as a Black person, as a minority person, that puts you at increased risk of health conditions. And that has a lot to do with something we don't like to talk about in the United States, which is sort of the inherent way that our country is structured, the inherent racism that's present in our country, the way in which our healthcare system has been set up to actually exclude particular populations from receiving the greatest benefit from our healthcare system. So really, if we're going to talk about these disparities that are occurring in coronavirus, we have to talk about the really difficult conversations that, we have to talk about the difficult things like racism, systematic oppression of particular populations, and xenophobia that occurs in our country here. And I'll just point out that, as I said before, there are many people who've studied this and have come to the same conclusions that, it cannot just be about the increase or the large amounts of comorbidities in these populations. We have to think about the social, structural reasons why these groups are experiencing higher rates of infection and higher rates of death. And I think that that's really difficult for people to hear and really difficult for people to understand. And if you don't mind, I'll recommend a podcast, actually. It's called the 1618 podcast. And episode 4 of that podcast actually explores the origins for a lot of these health disparities in the United States, and specifically looks at the reasons why our healthcare system wasn't actually set up to serve minority populations, and specifically Black Americans in the United States. So, again, I think it's really difficult to talk about, but it's really important to call it what it is, and to hope. I hope, one thing I actually hope that comes out of this is that because these disparities are now out in the open, people are thinking about them, people know about them. Perhaps we may be able to change some of these social and structural reasons why, Black, Latino American, minority Americans are experiencing these high rates of disease.
Yes, for sure. And thank you for that. Thank you for talking about that and bringing this issue to light. And it is a difficult conversation. And so there's other metrics with respect to, I don't know if you've ever seen this. I'm sure you may have come across it. So African American women are more likely to die in childbirth, something like 2 to 6 times higher to die in childbirth. And whenever that topic comes up, it's the same reasons: the behavioral versus structural. And so we have to keep talking about this and see if we can drill down and find out the origin of these disparities. The data scientist in me, wants to reach down deep for added skepticism that maybe there is behavioral influences to these issues, or if there are systematic underlying racial issues that are the cause. Perhaps it's a combination of both. I don't know, but I definitely think that the conversation needs to continue, and we need to do a lot to really find out the origin.
Yeah. And I think I will say that, some of it may be behavioral, but then we have to ask ourselves, well, why is their behavior different, right? And I think we'll come to the same exact conclusion, right? That there are reasons why behavior is different, and those have to do with the social and structural differences in the ways in which people are living. And I will correct myself. I said 1618. I think the podcast is the 1619 project from the New York Times, and the episode is episode 4 from that particular podcast.
Yeah, we'll definitely check that out. The 1619 project. Okay. Yeah. Okay. So let's talk about what it will look like when we finally come out of this. I mean, what does, in your opinion, what does the off-ramp look like in order to get back to normalcy? Can we get back to normalcy? And what do you think will be changed indefinitely, for the better or for the worse?
Yeah, it's a really difficult question. It's a question I've been asked a lot in recent days. And I will say that no one really knows the answer to this. No one really knows what the off-ramp is going to look like. I think that there are some things that we need in order to envision the off-ramp. So one thing we definitely need is we need a serology test. We need to be able to determine who has antibodies against the coronavirus, which essentially should translate to previously been infected with the coronavirus and who might have some residual immunity from the coronavirus. So while we don't know how long immunity will last with this particular virus, we don't have that information yet. Many of us are assuming that there will be some residual immunity, whether that's for a few months, hopefully for longer, but right now we're assuming it might last for a few months. So ideally, one way to sort of get off of our current road of social distancing is to get enough serology testing to better understand the total number of people in our population that have had the disease, have had some immunity from the disease, and we could potentially do some very targeted releasing of social distancing based on that. Now, there are a lot of ethical challenges there, right? Just because I didn't get the disease, does that mean I can't go back to normal? I don't know what that would look like, and I'm not sure that there's sort of an ethical way to do that at a population level. But what I do know is that a serology test is definitely needed, and it definitely needs to be widespread, not just available to those who are presenting at hospitals or those who've had symptoms, but we do sort of need to do a population-level assessment of how many people have had this disease. I think the other thing that would be very ideal and will help us get out of this much quicker is a vaccine. Now, the vaccine is not likely for another year to 18 months. And that's simply because it takes a long time to make sure that the vaccine is effective and that the vaccine is safe. So, if we had a vaccine tomorrow and if we had enough vaccine to vaccinate the whole population, we could probably go back to normal in a week. But the reality is the vaccine will probably come sometime next year. And when it does come, I think it will provide a lot of relief in the sense that we can hopefully be confident that many people will be protected from this and that they won't get the virus anytime in the near future. So a vaccine will get us off the hook right away. I think serology will help us along the way. I think the other thing that may help is treatment, so antiviral treatment that could allow us to reduce the severity of some of these infections, and that might help our healthcare system keep up with the demand that's ongoing now. So these are all things that I think would help. I'm not sure I know what the specific off-ramp looks like. I think one option is sort of a back and forth between extreme social distancing and a little bit of relief. I think people are exhausted. I think economically it may not make sense to maintain the level of social distancing we're doing now. But perhaps needing to cycle it on and off may be one way to think about the upcoming months as we move forward. There are, of course, pros and cons with that because, as soon as you let people go back to their normal lives, we will see an uptick in infections. But again, there's a trade-off between what people are willing to do and what we can do in terms of our economics and our mental health. So I think that's sort of one thing to consider. I think something I will say is we're fairly confident that this will not be over in the short term, that, while we may be experiencing the peak in many cities in the next few weeks, that doesn't mean that this epidemic in the United States is anywhere near over. We do expect other peaks to happen potentially later on in the year. So we do have to keep our guard up. We do have to constantly be thinking about, how it is that we can protect ourselves and protect those around us. And I will say, people ask me all the time, are we ever going to go back to the way we were before? Am I going to be able to, visit my family? Am I going to be able to teach a class in person, right? Am I going to be able to do all the things that I was doing before? And I do hope so. I mean, I do think that there is a possibility of going back to all of our previous activities. I will say that I don't know if that will happen in the near future. But I do think in the long term, especially with a vaccine, that's definitely something that we can expect. But I also will say that I have hope that, some potential good will come out of this. I mean, I think people are finding ways to build community, to maintain community in these dire circumstances. And I think that will only strengthen community when we are back to quote unquote normal. And I also have hope that, we will be moving the conversation forward about how to improve health in the United States. How is it that we can restructure our healthcare system to ensure that everyone has, fair, equal access to good healthcare? How is it that we can think about the social and structural determinants of health to improve the health of vulnerable populations in the United States? I mean, I'm hopeful that because these things are coming up now, hopefully we'll be better equipped to deal with them after hopefully this epidemic is over. And one big thing I really hope for is that our public health system will be better funded and better suited to handle potential threats in the future. Unfortunately, our public health system was not well equipped at the beginning of this epidemic. It had been severely underfunded. And so thinking about ways in which to ensure that our public health system is well funded moving forward, I think will only help us fight future potential threats moving forward.
Yeah, and just like you said, I think this was a sort of, in engineering they call it a smoke test, an unplanned smoke test, and it was a test of the system, and quite clearly the test of the system showed that we weren't ready. So, just as the 9/11 situation happened, it completely eliminated the possibility of anyone going into a cockpit. This unplanned test of the system may just shift everything, and like you're saying, the effect of this test, this unplanned smoke test, will have, potentially positive impact on many structural resources, as well as contingency planning, right? And so maybe when the next pandemic hit, we'll be better prepared. I also think something like shaking hands is something that might just drop significantly. I've already started, even before the pandemic, I stopped shaking hands, or certainly stopped shaking hands a great deal. I mean, I would, if someone else extended their hand, I would shake it, but for the most part, in greetings, I would not extend. And what I found out is that probably cut down my handshaking maybe 30% or so. But I think something like handshaking is probably going to almost completely go away. Do you think?
I would hate to think it, but I think that people will definitely change their behavior moving forward. And I think that might look differently for each individual person. But I definitely think that people will be, rethinking the amount of contact they have with others. And part of that makes me a little bit sad, right? I was speaking with my goddaughter the other day, who said, "I can't wait to give you a hug sometime soon over FaceTime." And I thought that was really heartbreaking, that there could be this potential threat of not being able to embrace our loved ones or to feel close to our loved ones in that way. So I have hope that, things will return to some sort of normalcy. But again, that might look different for each individual. And I think, making an individual choice to do that, as you said, can be quite protective for your health. And so it's a personal evaluation that you would have to take.
Yeah. You mentioned something about antibodies. So just to clarify that, so if you get COVID-19, you can't get it again. Is that right?
So we don't know that. So I want to be clear that is not necessarily true.
Okay.
So we actually don't know how long immunity will last. Our experience with these viruses in the past is that there is a period of immunity, but that there is the potential for a reinfection at another time. And so just because you've had it doesn't mean that you can't have it in the future. If you think of something like the flu, influenza, you can get the flu multiple times in a particular season.
Right.
And so, we have to constantly be sort of proactive about protecting ourselves, even if we may have had it or may have been exposed to it. So that is still yet a question that we need more data, more information to be able to really comment on.
Got it. Yeah, I think, one of the good things that it's going to come out of this is the trust of science. I've talked on other podcasts about science denial and how that is an existential threat. Everything from anti-vaccination people, people just promulgating pseudoscience ideas on how to cure bodies and alternative medicine, right? And so I think something like a pandemic rescales our trust of people like you, doctors, scientists, the scientific method, professors. And I think, just hearing you talk about how long it takes, for instance, before you can get a vaccine, things have to go through a process, double-blind, randomized trials, and this is playing itself out right now. I mean, at any given point in time, someone with their essential oils or something like that can prove us all wrong and cure this, but that's not going to happen. What's happening is real. We're seeing science and the scientific method play itself out in real time with a real world example, and I think this ultimately is going to be a good thing. Do you have any perspective and thoughts about that?
I hope that that's true. I really do. I really hope that we're able to convince the general public that as scientists, we have their best interest in mind. I hope that we're able to convince the general public that they can trust science, they can trust public health, they can trust medicine. And I really hope that becomes sort of more of a normal cultural value here in the United States in particular. I hope that that's true, and I hope that, something I think about a lot when I'm doing interviews or when I'm doing things that are public-facing is making sure that I'm speaking in a way that people understand, making sure that I'm speaking in a way that people feel like they can trust me. And I know that there are many other people out there who are thinking about the way that we communicate about science. And I think it's by being aware and being reflective about this as scientists, I think we can sort of change the norm about how the public views science. And I really do hope that this increases people's trust in us as a scientific community.
Yes. Okay. All right. So we want to be sensitive to your time. Is there anything else that you want to close with, and anything else that you want to communicate to our listeners about this sensitive subject?
Yeah, I mean, I think something I've been thinking about regularly is, the amount of stress that we're all feeling right now, the amount of anxiety and perhaps pressure that some of us are feeling. And I think our lives have really been turned upside down in many ways. And that could lead to, a lot of feelings of stress and anxiety that, again, can be detrimental to one's health and to one's immune system. So I think I'm speaking to a group of people who's really health conscious, really cares about their bodies. And something I'm going to be intentional about, and I hope others will be too, is, how we're dealing with our mental health and making sure that we're not ignoring it during this difficult time. Because I think it's a really important factor in our health and in our immune health and physical health. And I hope that, people are taking the time to really assess how they're feeling, deal with their feelings, deal with their stress. And one way might be through endurance sports. And I just hope that people are caring for themselves and also for others at this time. Being kind to our neighbors, to our friends, to our family, reaching out, speaking to people, making sure people aren't feeling lonely, I think is one way we can make an active difference during this pandemic.
Excellent. Thanks for that. That's a great message to end on. Now, do you have a social media presence? How can people go out and find you?
Yes, so I am on Twitter. I use Twitter very often, and it's my first initial last name. That's my Twitter handle, and I'd love to interact with people on Twitter, and I'm also on email, and maybe we can put my email in the show notes or something to allow people to contact me. I will put that in the show notes. I'll put your Twitter handle in the show notes. And, which race are you going to sign up for next? I was thinking about, I've been doing half marathons in the fall. So I've done the Boston half 5 times now. So I may, if it's open, I may go for number 6 this fall. All right.
You heard it, guys. Look for Dr. Abuelezam out there on the courses. Well, thank you for your time, and thanks for coming on to the podcast.
Thanks for having me. It was great speaking with you.
A big thanks again to Dr. Abuelezam for coming on to the podcast. I will put her username link on Twitter in the show notes. So I'm going to ask all of our listeners to go out and follow her on Twitter. Given what's going on in the world today, you can understand that she's being pulled in many different directions. And she recently even did a national spot on Chris Hayes' show on MSNBC, just to give you guys an idea of how busy someone like her is. So definitely go out and follow her. From now until we hit the COVID-19 off-ramp, whenever that might be, you're bound to get some more interesting perspectives from her. And you also might get some information about her marathon pursuits. We're going to draft her into our endurance enthusiast army. This was a great conversation and a great podcast. I think many people are going to find it informative. And I was left wishing that I had more time with her, particularly on the question about the disproportionate effects of COVID-19 on the black community. I feel like we just scratched the surface on that question, and we could probably have an entire podcast on just that topic. And maybe one day she might agree to come back on the podcast and have a longer conversation on just that topic. It's of interest to me, being black, but also being a exercise, nutrition, and fitness professional. And so I definitely have experiences there that I could share to and having a broader conversation about that. Finally, I will link to the study that I referred to out of Belgium and Norway, where a research team looked at how far you needed to be away from someone running and cycling in order to be out of a droplet stream. Not sure how high quality it is, but you can take a look at it. And I'll also put a link to the United States Masters Swimming Statement on Viruses in Chlorinated Pools. These two links might be of interest to our endurance enthusiasts and triathletes. And that's it for now. Thanks for your time. This is the Endurance Experience Podcast.
Follow Event Horizon Endurance Sport on Facebook, Instagram and Twitter for training programs and services. To become a member of our Endurance Institute or for a complete archive of podcasts, log on to our website, eventhorizon.tv.